How to improve your hyperpigmentation with injectable skin boosters. Now, hyperpigmentation is a huge subject and there's so much information coming out on it more and more every single day. It really has been a top trending subject of 2023. Now, with hyperpigmentation, it's very tricky to treat. So firstly, what I'm talking about here are how skin boosters can help, but what I'm not saying is this is suitable for everyone and this is what everyone needs to do to help clear or eliminate hyperpigmentation. It's more about building up an understanding of where injectable skin boosters fit in trying to treat hyperpigmentation. So with hyperpigmentation, essentially with the skin boosters, there are a few different options. So the two that I'm going to talk about now are going to be tioxane redensity 1 and polynucleotide treatment. They can both be beneficial in trying to help someone who's suffering with hyperpigmentation. So firstly, if I've got a patient who comes to my clinic and their primary concern is hyperpigmentation, these might not be the first thing that I go for. So there's going to be other options that might be suitable, such as prescription medical grade skincare, such as deep chemical peels, medical devices, IPLs and this type of thing. So there's lots of different things. That's why a complete assessment is important on every single patient to make sure we're picking the right option for you. Having said that, if we've explored all of that already and now we're just talking about anti-aging of the skin and we're trying to pick the best option of the anti-aging skin boosters, then that's more what I'm going to be discussing now. So these treatments are not going to be a first-line primary thing that I would suggest for hyperpigmentation, but they're more going to be useful adjuncts that I would use alongside the main treatment plans. I hope that makes sense. So with the injectable skin boosters, the first one I'm going to talk about is tioxane redensity 1. Now with the skin booster, think of it as little injections of honey just in your skin, and these injections just spread throughout your skin to form a layer of honey. So skin boosters are very different to dermal fillers, and we've actually got a video explaining those differences that you can have a look at if you'd like. But with the skin boosters, there's lots of different ones with different benefits. Now with tioxane redensity 1, that one has got a cocktail of amino acids, antioxidants and lots of different vitamins, minerals which are going to help improve skin. Now the main things it's going to help with are going to be tissue restoration and repairing and the benefits of the antioxidants on the skin itself. So with the antioxidants, some of them such as glutathione can have a brightening effect on skin, and that can be something that can actually mildly help hyperpigmentation. That doesn't mean it's going to get rid of it forever, it doesn't mean it's the cure to all of your concerns and needs, but it's a tool that we can use that can slightly help to improve an area of hyperpigmentation. Other things that are going to help the general skin remodeling and the skin restoration overall, so the hydration, fine lines, elasticity, all of that's going to improve as well, and that's the primary focus of an injectable skin booster. And actually with this one, it's got loads of minerals in it such as zinc and copper and things like that, which help the skin to remodel themselves directly. So when the skin's remodeling, that's going to help target things like acne scarring. So some people might have their pigmentation on the background of acne scarring, and actually this treatment's going to help slightly improve the pigmentation and improve the scarring itself. So through one treatment we're actually addressing two things mildly. That's not to say it's the main thing that I would do or the only thing that I would do, but it's a useful tool that we can use within our arsenal of treatments. The second one is going to be a polynucleotide. So polynucleotides are more a branch of regenerative medicine, so they're not using hyaluronic acid. This is actually using fractionated DNA that originally comes from a salmon or a trout that works with your own DNA to basically optimize certain cells within your skin. Now with these cells within your skin, they're going to be the fibroblasts specifically, they're going to be ones that help produce more elastin and more collagen. And when these fibroblasts are working more optimally, it can help certain areas of hyperpigmentation. Now again, I like to talk about things with levels of certainty. So if I've got a patient who's coming to me because their main concern is they feel like they look tired, now I can go through treatment options and I can discuss things with 99% level certainty personally. That's what I'd be comfortable to say, because if I'm treating someone and their main concern is, they've lost a bit of volume, their anatomy is changing, they're looking like they're not looking how they used to look basically, and that's their main concern, that's an equation of you're losing a bit of volume. When I restore this volume here, it's going to move back to how it was before. And these discussions can be had with really high levels of certainty. When we're talking about things like hyperpigmentation or melasma, the level of certainty reduces, because what everybody would want is, one thing that works for them and works forever. But unfortunately, because it's quite difficult treatment to manage, there's lots of different levels and there's lots of different, scales upon which people can be suffering with this. So for people who have it quite mild, maybe I wouldn't even go for a skin booster. Maybe it would be, something we could best address with topical skincare, prescribed skincare at home. If I've got more severe cases, maybe that's where we need to use things like the medical devices, deep chemical peels. Maybe these type of skin boosters need to be used to optimize that type of thing between treatments, because it's going to help with what we've already discussed, plus just general skin anti-aging. So it's not to say that one treatment fits all or one thing is the best option. Really, you're always going to need to have a detailed consultation with your doctor to really understand what each specific treatment is doing and how it's going to help you. So one of the main reasons that people get hyperpigmentation is sun damage, and that's why there's such a huge drive on the importance of sun protection. So the sun actually causes about 80% of skin aging is attributed to UV damage. So even people who are using sun protection all the time, they're still going to get impacted, maybe not as much, but they're still going to get impacted. And there have been lots of really cool studies that have looked at, twins who've got the same DNA, right? So it's got twins, and it's looking at one who's used sun protection versus one who hasn't, and it shows a really big difference in what's happening to their skin. So that shows alone the importance of sun protection. Having said that, just because someone uses sun protection all the time, they can still get hyperpigmentation, because some people are more prone to it than others, which seems unfair, but it's just a reality of it. Another really tricky subject is going to be the skin changes that take place during pregnancy, because if someone's going through pregnancy, that actually rules out lots of different treatments that we can do. So that's going to be quite a challenging thing to deal with. Having said that, it's still worth having a consultation with your doctor, because there are certain things you might be able to do that are going to help minimize skin changes, or it's just good to have peace of mind of knowing what a plan would be if you're concerned about skin changes throughout pregnancy and what can be helped quite easily. So finally, I'm just going to talk a little bit about Redensity 1 and where we commonly use it in our clinic. So the most common use that we have is for people who want to use it on their face, and that's going to be for anti-aging, scarring, mild support for hyperpigmentation, and that's going to be the most common. So about 90% of cases probably are going to be on the face. Having said that, the next most common area is going to be the neck. So within the neck, it's so often you'll see someone who's got a really well-maintained face and they look like they haven't aged a day, and the giveaway is going to be their neck. So whenever we're looking to maintain someone's facial appearance, we should always consider the neck as part of their overall face, because it's always on display as well. So the neck and the décolletage area are really nicely treated with Redensity 1, because these are areas where the skin gets quite thin, and when it gets thin we've got the lines and wrinkles, and also this can mildly help with pigmentation and texture as well. So these areas are quite sun exposed and can get quite sun damaged. So Redensity 1 is going to be a brilliant treatment there. So that probably makes up the next 9%, so that's 99% of our cases. And then for a few patients who want to take this to the next level, I guess the next level is going to be hands. So hands again are an area where we start to lose volume, our skin gets a bit thinner, and hands can always give away someone's age a bit more so than their face and neck. So it can also be used very nicely and effectively in the hands too. I hope you found that useful and informative. If you've got any other questions on skin boosters or any other treatments or anything to do with hyperpigmentation, the best thing to do is get in contact with us and we'd be happy to help you.